Have you noticed a blister that looks like this, either on your genital area, your lips, your butt, or other parts of your body? What could be coming into your mind? You should know you are having herpes, not any other thing, it's herpes. Some people mistake this for yeast infection, for dermatitis, for other kind of infections, not knowing it's herpes. Herpes can appear under your lip or your genital areas, and it's entirely normal as related to herpes. So in this video, I want to be explaining what is herpes, what causes herpes, the signs and symptoms you experience aside from the blisters you have on your body. We're also going to be explaining how to prevent this deadly viral disease, and we're also going to explain the quality management of this particular condition, because so many people don't know that this condition can be managed, and that's why they end up having complications relating to this herpes. So in case you are seeing my face for the first time, please do well to subscribe to my YouTube channel, and don't forget to also share this video to as many people as you can so they can learn from what you'll be learning today. Now, herpes is a viral disease that is caused by herpes simplex virus. Herpes simplex virus is the major virus that gets into the body via sexual contact, via oral contact. In case you have a kind of oral contact with a person that is infected, you have a kind of oral sex with a person that is infected, you can get this virus into your system. And just for information's sake, this virus is not curable. Once it gets into your system, it stays there forever. But that doesn't mean this condition cannot be managed. But before we discuss the management, let's explain the signs and symptoms you will experience when you're having this kind of condition. One of the major signs and symptoms people will always experience is a painful blister that will either appear on the side of your lip or the side of your vulva as a woman. You might also experience blisters at the size of your balls, your scrotum, or the size of your penis, mostly at the tip of the penis. This is caused by herpes virus. But don't forget that there are different strains of herpes. There is the HSV1, HSV2, which means herpes simplex virus 1 and herpes simplex virus 2. The HSV1 is most associated with oral herpes, which means it causes blisters and oral herpes symptoms on the mouth, while HSV2 is mostly associated with the genital areas. Example, herpes symptoms that appears on your penis, that appears on your anal region, which is your anus, and that appears on your vulva region as a woman. This is caused by HSV2, which means herpes simplex virus 2. Now, there are ways you can manage this condition, and this is where people get it wrong. Most people manage this condition by using antifungal medications. Now, antifungal medication will have no help on this kind of management, because the herpes is not caused by fungi. It's not caused by bacteria. That many people will be using antibacterial medication like levofloxacin, ciprofloxacin, ampiclos, and so many of them. This will not help because this condition is caused by a virus. And if you are managing it, you need to use antiviral medications, not antibacterial medication. This is where the difference comes. Now, one of the major antiviral medications that doctor will always recommend when you're having this condition is valacyclovir, which is very, very effective in the management of herpes. And mind you, when this condition is in your system and you don't manage it, it gives you a high chance of transmitting it to others. But once you are taking your medications, it might reduce your chances of transmitting it to others. Now, the second medication is acyclovir, which is very, very effective in reducing the viral load of this virus in your system. But that doesn't mean it cures this condition from your system. Just that you taking this medication will reduce the outbreak, which means you will not be having those blisters to be appearing every now and then. It will reduce the frequency, and with time you might not even get to see these blisters at all if and only you are taking these medications the way you are supposed to take them. Now, people will always say they are having pains when they are having herpes. There are other medications that accompany this antiviral medication that will reduce pains when you are having this crisis. One of the major medications that we always recommend are topical medications like lidocaine, which can reduce the pain you might be experiencing at the site of the herpes blisters. You might also need tablets like ibuprofen, diclofenac, paracetamol that can help relieve the pain you'll be experiencing while having herpes. For some people, you might need acyclovir cream, which you can just apply on the blisters while you are having crisis. And in this case, the blisters will get to heal more faster. And I will always recommend personally vitamin C, because vitamin C really helps in wound healing. So if you're having blisters all over your body caused by herpes, one thing you should not play with is vitamin C, because vitamin C will get them to heal up fast. It will build your immune system, and in that case, your body can naturally fight them out of your body without any delay. So in case you're having questions about this particular topic I've just discussed, please do well to drop it in the comment section, and I'll be right there to respond to them. And don't forget to subscribe to my YouTube channel so you can get more amazing videos like this. In my next video, I'm going to be explaining to you other things you need to know about herpes, so you can get to learn everything you will need to know about this particular condition, which is called herpes. Thank you for watching this video. I'll see you next time.